Greetings. My name is Payam Sheikhattari, and I'm giving this presentation on behalf of my colleagues at Morgan State University. The title of our presentation is A Collaborative Pilot Study to Design and Optimize the CESE Digital Peer Motivation Smoking Cessation Intervention for Underserved Population. CESE is a community-driven smoking cessation initiative that evolved through a collaboration between Morgan State University and residents of the Southwest Baltimore communities. It stands for Communities Engaged and Advocating for a Smoke-Free Environment and focuses on serving the underserved and local low-income populations that lack affordable, consistent, and accessible community health-related resources. CESE, as depicted in this picture, has been designed based on a four-stage iterative model comprised of building partnership with a diverse group of stakeholders, conducting assessment to inform the design and redesign of effective responses and interventions, engaging peers to provide services, and institutionalizing and sustaining the intervention through establishing long-term relationships and enhancing the quality of services. CESE initially started in 2008, and since then, multiple phases of the intervention has been tested. The design of each phase of the intervention has been informed by lessons learned from previous phases and inputs from community and academic partners. For example, CESE Phase 1 intervention was conducted in clinical settings, where individuals and group counseling were offered by doctors and nurses respectively. However, after co-analyzing and reflecting on both qualitative and quantitative results, it was decided to offer the second phase of the intervention in community settings by locally trained peer motivators who have been ex-smokers for at least 1 year. That approach found to be more promising and cost-effective, and therefore were further tested with different vulnerable groups and offered with different levels of intensity in subsequent phases. A few CESE-branded materials, such as CESE Today Smoking Cessation Manual, were developed throughout this process as well. Subsequently, these efforts led to the ideas for current project to design and optimize a digital or a digitized version of the CESE to be delivered through virtual platforms such as Zoom. CESE digital intervention will be tested in 3 geographic locations in Baltimore City with comparable socio-demographic profiles, where participants from each community will attend either in-person classes, virtual classes, or use the materials as self-help tools after receiving an initial training and orientation. All 3 groups of participants will take a baseline survey, receive nicotine replacement therapy, and are followed 3 months after finishing the program. The research team co-designed the virtual version of the CESE intervention in collaboration with community partners that included a website mirroring the print version of the CESE Tobacco Cessation Manual, a study protocol, and a peer motivators facilitation guide. To make sure that all of these materials and methods and tools and forms are ready, it was decided to pilot test the intervention with a small number of participants from the target community. As a result, 227 participants were surveyed. 18 of them were enrolled into either in-person or virtual classes. 12 could be reached during the 3 months follow-up, who also attended 2 focus group discussions. The pilot results show that 63.9% of survey participants reported being current smokers, from whom 90% expressed willingness to join CESE classes. In smoking cessation classes, 2 out of 4 participants of virtual classes and 3 out of 8 in-person participants reported non-smoking at the follow-up, at the time of follow-up. As a result, we have accomplished a few things, such as designing and testing the CESE digital study protocol and the peer motivation facilitation guide. The intervention was revised and optimized using the input from the pilot phase, and now we are going to launch the CESE digital study with participants enrolled